Hello Whitechapel class, my name is Howard and I'm a dental hygienist and dental therapist. Your teacher, Miss Blake, tells me you have loads of questions for dentists and questions about teeth. So she sent me 10 questions which I'm going to answer for you guys today. How do your teeth fall out? That was your first question, which is a very good question. I'm sure a lot of you have baby teeth, some might be wobbly. You might even have some of your adult teeth coming through, which is amazing. So how do they fall out? Baby teeth normally fall out when the roots, so the legs of the tooth that hold it in place, start to disappear. So slowly the roots start to disappear and they start to get wobbly. And the reason this happens is because your adult tooth is ready to come out. So once the roots of the baby tooth has disappeared, then your adult tooth can come in. So then your baby tooth would fall out because it no longer has the legs that hold it in, which is known as the roots. That bit here, that's the roots of the tooth. And then you can see slowly the roots start to disappear, and so the tooth starts to become wobbly. Eventually, once the roots have completely disappeared, baby tooth falls out. Another way a tooth can fall out is if you accidentally fall over, or if you hit your face, then you might knock your tooth out. And then your adult teeth can also fall out if you have an accident and you fall over and you knock your tooth out. Another way your adult tooth can fall out is if you have gum disease. It gets worse and worse over time, and then eventually the adult tooth becomes very wobbly and just falls out. And that usually happens when you have lots of bacteria and bugs and they start to irritate your gums, which causes them to bleed, and then eventually your adult tooth just can't take it anymore and it eventually falls out. So gum disease can make your adult teeth fall out. You can fall over and your adult teeth can fall out, can be knocked out. You can have your baby tooth. When your adult tooth is ready to come through, your baby tooth can fall out. Also, you might be playing or fall over and your baby tooth can also be knocked out. Another question you guys asked me was, why is it hard to pull your teeth out even when they are sometimes wobbly? So the reason why it can be sometimes hard to pull out your baby teeth when they're already wobbly is because the roots, remember the legs of the tooth, haven't fully left yet. So they haven't fully disappeared. So sometimes you can have one root that's completely gone, but there's still another root left. And so the tooth is a bit more wobbly, but you still have to tug on it a little bit to get it out because it's not fully ready yet. So if your tooth is wobbly but you're having a difficult time to get it out, it's because it's not really ready to come out. And sometimes it may be wobbly because maybe you've actually fallen over or you've actually bumped your tooth and then it's wobbly and it's actually not ready to fall out. In that case, you want to see a dentist as soon as possible. But your teeth are usually wobbly and hard to take out because the roots are still there. They haven't completely disappeared yet. Maybe a little bit of it has disappeared, but there's still some left. And so that little bit that is left is just hanging on really tightly. The next question you asked me was, what is the process of getting your tooth dirty? That is a very important question to know, because if you know how your teeth get dirty, then you'll know why it's so important to brush. So the teeth get dirty naturally. So we have something called plaque in the mouth, which is, it starts off with a very sticky layer and then all this bacteria and bugs basically stick to it. And then as you eat your breakfast, your lunch, your dinner, your snacks, all the foods you eat get stuck onto this sticky layer, and that's what makes up plaque, and that's how you get your teeth quite dirty. But the plaque and the sticky layer, it just always builds every day because in our mouth, we naturally have some bacteria there. In order for you to get rid of the dirt on your teeth, you have to brush really well, twice a day for 2 minutes. You need to study to work in a dentist. So in a dentist, we have receptionist, we have a dental nurse, we have a dental hygienist or dental therapist like me, we have a dentist, and we have lots of other different types of dentists. So dentists for braces, that to make your teeth nice and straight, and dentists who just love doing fillings all day long. In order for you to get into dentistry, you would need to study science. You have to study biology and chemistry because you have to learn about the body. And then you can add any extra subjects you like. And then once you've finished studying biology and chemistry, when you go to university, you're going to study dentistry or you can study dental hygiene and dental therapy. Why do we have baby teeth and adult teeth? Why do we have baby teeth and adult teeth? This is a really good question, and I did ask some adults this question and they didn't get it right. So this is a very clever question. The reason why we have baby teeth and adult teeth is because, number one, when you get your baby teeth, it's because you're a baby and you've got a very small mouth. And as you can see here, this is the baby mouth and this is the adult mouth. And so the baby mouth looks a lot smaller than the adult mouth. So when you're a baby, you get these tiny little teeth that can fit in your mouth. And then when you get bigger, everything gets bigger. Your nose, your eyes, your mouth gets bigger. And when it gets bigger, it means there's space for more teeth and for bigger teeth. So then you get your adult teeth. The reason why you don't just have one set of teeth is because your mouth is too small when you're a baby to have all the teeth an adult has. You have to wait till you get a little bit older so that you can get your full set of teeth. If you had adult teeth in a very small mouth, it wouldn't be very comfortable. And as you can see here, the baby teeth only has 20 teeth and the adult teeth has 28 to 32 teeth. That's a lot of teeth. And this is important so that you can chew your food, so that you can speak, so that you can smile. So that's the reason why we don't just have one set of teeth. It's because when you're small, you've got a small mouth, and when you get older, you've got a bigger mouth, so your teeth have to change. How can we get rid of decay? This is a very good question because a lot of people get decay, even adults. So to get rid of decay in the early stages, when you first start having tooth decay, the best way to get rid of it is to use a toothpaste that has something called fluoride in it. Fluoride is something that helps to reverse tooth decay, or it makes it static. And then that means that your tooth can heal itself. So when you brush your teeth 2 times a day for 2 minutes, the fluoride is going to help get rid of the tooth decay at the very early stages. If it gets later on and the tooth decay has been happening for a long time, it gets a lot harder to get rid of it. So you'll have to go to the dentist and have the dentist take out the tooth decay and fill it up with a filling. Here's a picture of a tooth that I filled that had tooth decay in it. So I made a big hole, took out all the tooth decay and then filled it up so that there was no more tooth decay. So that's one way to get rid of it. Another way to get rid of it is by taking the tooth out, which we don't want to do. But if it gets really, really bad, then we'll have to take the tooth. If it gets really, really bad and you're in pain, then we'll have to take the tooth out. Do you get gold and silver teeth from eating your vegetables? Oh, this one's an easy answer. It's a no. You don't get gold and silver teeth from eating your vegetables. Usually the dentist has put those fillings there. What is your favourite thing about your job? So my favourite thing about my job is treating patients who are scared of the dentist and getting them over their fear of the dentist and then getting them to good health. I really love to see those patients' progression. I really enjoy that. I also really enjoy doing fillings. I love filling teeth. I feel like it's like artwork because you've got to make the tooth look like it was before it had a big hole in it. So I quite enjoy doing that as well. How many sweets do you eat? This is a very important question, isn't it? How many sweets do I eat? Well, I don't really like sweets, but I absolutely love a chocolate bar. And I absolutely love cake, which is full of sugar. But these are the two things that I love. I love chocolate and I love cake. And that's my favourite cake and my favourite chocolate. And you also asked how often do I eat it, and I usually just have it either once a week or once every 2 weeks. So the last question is, what is the worst type of sweet to eat? The worst type of sweets to eat are the ones that are chewy and they get stuck on your teeth, and lollipops because you're eating it for a long time, and so that sugar just keeps working on your teeth and more bacteria keeps building up and loads of bugs just keep sticking to that sticky layer, making your teeth get even more dirty. So chewy sweets because they get stuck in your teeth, and lollipops because you're sucking on it for a very long time. So let's try to avoid those, guys. Well, that's it. That's all your questions. I hope I've answered it well enough for you guys, but it was very lovely doing this video for you all. So thank you, Whitechapel class, and thank you, Miss Blake, for having me. And hopefully we'll see you next time. Bye.